pass it to my colleague Janine.
Thank you, Ellen. Good afternoon, everybody. I'm so glad that we have such a nice size audience today. It's good to see everyone here. We wanted to take some time to introduce ourselves and the work that First Children's Finance does before we start talking about the cost of care study. So first, thanks to everybody who introduced yourselves in the chat. If you haven't yet, if you have a moment, drop your name and where you're joining us from. As I mentioned in the chat, my name is Janan Koto. I'm on the First Children's Finance National Systems team, along with my colleague Ellen. I'll pass it to her to quickly introduce herself, and then I'll tell you a little bit about our organization.
Wonderful. Thank you again for joining us today. I'm Ellen Nicodeme. I'm a systems analyst on the National Systems team alongside Janan.
So a bit about our organization, First Children's Finance. We have been around for over 30 years. We are a national nonprofit that is dedicated to growing the supply and business sustainability of excellent childcare. And that happens across 3 different levels. We partner with childcare businesses to strengthen their operations and help achieve their dreams. And we do this through providing trainings, business support, and financial analysis to business owners, and by providing loans to childcare businesses. We also consult with communities to achieve a sustainable childcare supply that meets local economic and cultural needs. We do this through strategic planning and technical assistance. So, for example, in Minnesota, this looks like the Rural Child Care Innovation Project and the Strategic Supply Plans projects. And then finally, where the work that Ellen and I do sits, we have the systems level work. So we help change public systems through advocacy and expertise, elevating childcare.
Sorry, we lost Janan there. You can close out with what she's saying on this slide. We changed public systems. So the systems team, as she's noting, that we sit on partners with public systems through advocacy and expertise, elevating childcare policies, practices, funding, and plans. So this is where the work that we're talking about today falls. I'm going to spend a little bit of time talking about what a cost of care study is. So a cost of care study estimates, in many ways it is what it sounds like, but estimates the per child cost associated with providing care for children, including staff salaries and benefits, center and home facilities and food costs, curriculum and facilities. I think one of the things that's important to note as we look at a cost of care study is distinguishing between like price, which is the price that families are paying for childcare, and costs, or the cost of what it takes to really operate a childcare program. And this study is really focused on that expense side, so the cost that childcare providers experience in running their childcare program. Cost of care studies are often conducted by states in parallel with a market rate survey. So a market rate survey provides information about, again, that like price of childcare services, whereas a cost of care study focuses on the actual costs associated with caring for children. So studies in Minnesota and other states have shown that for many childcare programs, the price of tuition doesn't reflect that cost of providing care. We know that families can only afford so much. So many providers set tuition rates based on what local families can afford, and then are creative and resourceful and have to figure out how to balance their budget to work within those constraints. So within that context, like setting policies like CCAP rates that are based only on price without understanding costs can perpetuate the underfunding of childcare. So cost of care studies really try to help us understand the actual costs that go into providing care. And they can show how the business model for childcare works or doesn't work, how and why there may be difference in costs between rural and urban areas, or differences in costs across age group, differences in costs across center side or license types, rather, with the goal of making more informed, effective childcare policy, and especially CCAP rates. We are conducting this study on behalf of the Minnesota Department of Children, Youth, and Families, with the goal of supporting DCYF in exploring new approaches to setting rates for CCAP. This study might also be used to inform pricing of other programs like early learning scholarships. I think it's important to note that this study is not a guarantee of raised CCAP rates. There are many other advocacy efforts around rate increases, and it's really part of a longer term effort to inform the way that CCAP rates are set and the level at which they're funded. I think we see, looking nationally, that there's a growing movement in other states to use cost of care studies to inform really increased rates for subsidy, and a lot of attention across both sides of the aisle on ways to better support childcare businesses and childcare access. So important that there's momentum behind this effort, but also want to be clear that this is not like a quick fix or something that will kind of be immediately implemented. This is an update of a 2023 cost of care study that FCF completed, which provided an additional view and set of data to DCYF and policymakers on some of the realities of business operations for childcare businesses in Minnesota. DCYF is continuing to complete regular updates of the cost model to track and understand changing dynamics for childcare businesses, and this is part of that update. And will be a big part of our conversation today. I'm putting a link in the chat to the FCF website that includes a link to that final report from 2023, as well as some briefs that we put together for childcare business owners that summarize some of the findings of that report. So it's so important to spend some time thinking about like both what cost of care studies tell us and don't tell us. So cost studies use averages, and the average cost experience is by different types of childcare businesses to create a kind of model budget of a typical or average childcare program. And as a result, they don't reflect the experience of like any one or every program. We use different models. We develop different models to represent both family childcare homes and centers, program different models to reflect different costs across geography, as well as parent aware rating. So these models are developed using data from many childcare businesses, so things like the average cost of insurance, as well as some assumptions for things like common staffing patterns or ways of implementing high quality practices in your programming. And those kind of assumptions are informed by childcare business owners and administrators. But again, because those are based on averages and assumptions, they won't perfectly match the experience of any individual program. And it also means that any business information that you share by participating in this study will remain private. So nothing that you share will be shared with DCYF or in public reports. It just informs those averages that are used in the model. And then finally, we recognize that programs are really resourceful and creative in navigating the dynamics of the business landscape today. And we also know that if we want investment in the ECE field, we need to understand what it would cost to provide childcare in a way that really reflects the true quality of care. So in addition to modeling the costs that programs are currently experiencing, we will also be developing a future state model that reflects the cost of what it would really cost to operate a true high quality program in a resource rich and supported environment. So as we consider the future state, we'll explore the costs associated with providing things like higher compensation, more planning time, insurance and retirement benefits, and all of those kinds of things. And again, community input will shape kind of what is included and not included in that future state model. Back to Janine.
Thank you, Ellen. Hopefully my Zoom doesn't crash. I closed some programs, so hopefully that will help. There will be multiple ways that you can participate in our cost of care study and give input. So we'll talk through some of those today. The first is there's a core team of First Children's Finance staff working in partnership with DCYF research and data team that will conduct and lead the study. And DCYF leadership will act as final decision makers as we hit decision points throughout our study and the process. The next is we have assembled an advisory group, which is a small work group made up of childcare business owners from across Minnesota. And they are engaging throughout the study to help ensure that all elements of the study are accessible, accurate, and informed by the experiences directly from the field. Next, we are going to be having community conversations. So associations, networks, and community leaders, through those community conversations, will have opportunities to ask questions, share input, and help generate awareness of the study through one-on-one meetings, focus groups, and participation in standing events. So, for example, today's listening session would fall into this bucket. And then finally, this is where we really start to see the picture of what the cost of care looks like is through surveys and business interviews. So all licensed childcare businesses in the state are asked to help inform our study by completing a survey or by participating in a more in-depth business interview.
Thank you. So all of these pieces of community input will come together over the next year and a half. You can see the kind of study activities outlined here. So we spent this spring and summer developing the survey and business interview data collection tools with support from the advisory group. And I've also been connecting with community organizations across Minnesota to build awareness of the study and inform the study. Excited that we'll be launching the cost of care survey next week. So keep an eye out your email inboxes early next week for that survey. And we will also begin business interviews early this fall. We'll continue to have conversations with community organizations and partners as we share about the study launch. We'll then spend the winter and spring working on data analysis. So we'll bring all of those pieces of data together to understand some of those average costs. We'll continue to check in with community groups and our advisory panel along the way with the goal of keeping our data analysis connected to the experiences of the field. And then we'll also finalize the assumptions that we're using in the cost model during that time. And then finally, in the summer of 2026, we'll release the cost of care report to DCYF and the broader Minnesota community. So in addition to the full report, we'll also create a series of business briefs that present our findings and data back for the childcare provider community. So we take really seriously that you all are sharing your time and data and information with us, and we want to share that back in a way that is meaningful, interesting, and accessible for you. So we'll be working to summarize information back to you next summer. I'm going to pause there for any questions that folks have about the study. Hearing none, please feel free if other questions come up as we talk, feel free to add them again. Either you can raise your hand or ask your question in the chat or just come off mute, whatever is best for you. Just want to first thank you for participating in the study by joining us today. We're really committed to providing multiple convenient, easy, accessible, and secure ways for childcare businesses to inform and participate in the study. And so thank you for being a part of that today. As Jenan noted, two of the big ways that will for your participation are through our survey, which will launch next week. So keep an eye out in your email inbox for a survey from us. That survey won't ask about all of the costs that you have, but instead it will focus on those that we expect to see the most variation or difference across things like geography or program size. So for example, the survey will ask about things like any personnel costs if you had staff, costs for space, or costs for program related to program quality. The email that you will get about the survey will note some financial documents that you could gather to help you quickly and easily complete the survey. Just want to note you're not asked to upload any of those documents. Those are just suggested as a reference for you to make it a little quicker or easier to complete the survey. So if you have those documents together, the survey should take somewhere between 15 and 20 minutes to complete. And there is an option to save and return to it later if needed. Everyone who completes the survey and provides contact information will be entered in a weekly drawing while the survey remains open for a $100 Visa gift card as well. And then the other opportunity to participate is business interviews. So FCF will meet with childcare business owners to really dig into their finances and understand kind of all of the costs that they experience. Ahead of those interviews, we'll ask participants to share some financial documents with us. So things like an annual budget or annual financial statement. And those will be used to guide our conversation and understand your program costs. We'll also provide a worksheet if you prefer not to share those financial documents ahead of the call. Those interviews, participants will be compensated for their time. So you receive a $100 gift card for participating in those interviews, and you can sign up to participate in an interview during the survey. All of the information shared through surveys and interviews with FCF will be stored securely and de-identified before anything is shared publicly in the study. So again, everything would be shared in those big averages. We'll be translating study materials into Spanish, Hmong, Somali, and we'll do our best to fulfill other translation or interpretation requests. So thank you again for being here today, and we really hope to hear from you as we continue on in the study. Any other or any survey, is an interview, study questions that folks have? We'll move